We're back again at Main Street Chiropractic with Dr. Mike, and this time I want to ask Dr. Mike a little bit about chiropractic care for kids. I keep hearing all kinds of things about how chiropractors are working with children and things like that, and I want to understand more what kind of problems our kids are dealing with that chiropractic care can help with, and what kind of treatment plans are they looking at, and is this a long-term thing, or what kind of problems are you dealing with kids?
Well, with kids, it's very interesting because a lot of people don't think that their kids would even need something called, with chiropractic. But the fact is that kids are actually the most active of any age group. I mean, they're going out, they're running, they're jumping off of things they shouldn't be jumping off of, they're falling all the time. So it's really important to make sure that if something, arises, you get it fixed. Now, on the other side of that, because they're kids, they heal a lot faster. So if there's an issue, we can get that, fix it a lot quicker than if that issue was to stay there and fester for 10, 20 years. Then when they're in their 40s, they notice that they've had chronic neck pain, and it's going to take a lot longer to get any kind of results there.
What would be the easiest way for me to find out if my kid would even need any kind of chiropractic care? Is it something where they're coming to me and saying, Mommy, my neck hurts, or something like that? Or is it more of a, getting your kids checked out once a year or so often like that, just to see if there are problems that maybe your kid doesn't even realize? How would you even go about doing something like that?
Yeah, it's a good idea to get your kids checked out. I mean, pretty much everything they do is going to affect them some way. Even the birthing process, I don't know if you've ever, obviously if you've had kids, if you've ever watched it, it can be pretty traumatic, especially with all the pressure they're putting on the head when the doctor's pulling out the baby. That's putting stress on the neck right there. So it's a good idea to get the kids checked out. Now, they also might complain after a fall that, oh, my neck hurts, my shoulder hurts, my wrist hurts, which, right away the parents think, oh no, something might be broken. It might not be that extreme, but if you were to go into a chiropractic office, they could find out if something is broken or whether it's going to be something that, maybe 2 visits and they'll be perfectly fine.
Now, you mentioned that even the birthing process can add a lot of strain on a baby, etc. So how young your kids are you, are you recommending chiropractic care for?
The youngest child I've ever treated is a few days old, and I say the oldest patient I've ever treated was 99. So it's pretty much the whole gamut. And we don't do the same adjustments for kids that we do for adults. Obviously, kids are a lot more fragile, so we do a lot lighter adjustments. It's a different technique, and it kind of goes full circle because as patients get older and they get toward their 90s, we do lighter, more different techniques as well. So it's very specified. So you want to make sure that if you are going to go to a chiropractor for your children, you go to someone who actually knows how to treat the children, because it's not the same type of care they would give to an adult. Okay,
my last quick question on this, because I know I would deal with this if I brought my kids in. Kids are always terrified of doctors' offices. So, and not understanding, the chiropractic process and adjustments and things like that, how do you explain what you're doing to kids? And how do you help them feel more comfortable in your office and not be scared to come in?
Yeah, what I found with dealing with kids is that you don't talk down to them, obviously. You just talk to them, explain what you're going to be doing, that you're just going to be feeling their neck or their back or their wrist or whatever, issue needs to be addressed. And then you show them what you're going to do before you do it. You don't just go through and do an adjustment on them. You talk to them, show them, maybe if their mom or dad's there, you show them on their mom what you would be doing to them, but, not actually doing the adjustment. But that helps the kids get more comfortable. It also helps, you don't take them in the room by themselves. You let their parents come in. That way they can feel more comfortable. And just, them also seeing only the doctor. They don't have another nurse there. They're not seeing all these needles and things like that. Gets them a lot more comfortable as well.
Okay. Thanks again for giving us a little bit of insight into chiropractic care for kids.